You are watching Radicon.
So this case, I mean, the answer is there on the film, but the point I'm trying to make here is you have to take an overview. If you compare the right side with the left side, there's obvious hyperplasia, you can say, or there is a smaller right hemipelvis in contrast to the left. And in addition to the coxa valga and abnormal alignment of the proximal femur. So whenever you see a diffuse morphological hyperplasia of the hemipelvis, think about underlying congenital abnormalities or underlying neurological abnormalities like poliomyelitis. Right. This case, I mean, there is obvious abnormality of the right hip, which looks like it is subluxed or dislocated. There is this modeling deformity of the right femoral neck. But keep looking. Again, you're thinking about something congenital, something neurological, right? But if you compare the soft tissues of the right thigh with the left, you can see there is gross discrepancy. There's more soft tissue with all these kind of skin folds. So suddenly you start thinking, could this patient have elephantiasis for that matter? Or with that kind of appearance, you think about neurological things. You have to consider whether she's got plexiform neurofibromas. So this is a patient of neurofibromatosis. Always look at the soft tissues and any soft tissue calcification, any soft tissue discrepancy, and then that can point you to the correct diagnosis. Right, this is the last case. Young patient with abdominal pain. And you see these two small phleboliths in the lower pelvis, but then you see this solid calcification, which is just kind of to the right of the midline in the pelvis. And then when you see it in a female with abdominal pain, this is a classic kind of case. I mean, you have to think about an ovarian dermoid. This is another case which presented to our emergency with ovarian torsion. And then you can see on the scout film, you can see calcification again to the right of the midline. And on the coronal post-contrast CT image, you can see that focus of calcification is the tooth. You've got fatty, a component of the dermoid with soft tissue, and then there is a large ovarian cyst concomitantly in the right ovary. This patient was taken to theater and the ovary was found to be torted. So again, soft tissue is around the pelvis, but you don't have to forget that there are soft tissue, there are viscera within the pelvis. So sometimes the pathologies lie in there. So to conclude, just to reiterate the important precepts that we've applied throughout these cases, and I hope that let's do it again. Right, so to conclude, we've applied these important precepts on the cases, and you must have noticed that most of the time by applying these principles, we are able to find the abnormality. So don't forget your review areas: sacrum, acetabulum, iliac blades, proximal femora. Look at the edges of the film. If there's another view, ask for it. Yeah, and then don't forget previous imaging. Right, so stay safe and go Corona go. See you again. Thank you.
This video is presented in collaboration with Radicon Institute of Radiology. You are welcome to subscribe to our YouTube channel and click on the notification bell for updates. For more modules in radiology CMEs, please visit our website www.radicon.org.